Doc, another topic naman po yun nga po sa masking resolution ng ITF. You said na nga po earlier na hindi pa po tayo pwede magtanggal ng mask kasi nga we need to increase the booster vaccinations. Pero ano po ba ang siguro pinaka best way po na parang middle ground dito? Kasi according to OIC Vergere daw na parang dinecide daw ito ng economic managers itong pagtatanggal ng mass sa outdoor space kasi nga to increase daw the tourism or increase the number of tourists daw in the country. So ano pong pwede natin gawing middle ground dito?
Okay. One, lifting outdoor face mask is not for the general public, not for everyone. And face mask outdoor should continue, one, for those children less than 12 years old because a lot of them are still not vaccinated. Second, the vulnerable population. These are the 50 years old and above, those with comorbidities, those who are immunocompromised, and those who are unvaccinated. So we need to be specific about that this is not for everyone. This is only for there are selected individuals that we need to continue to wear face masks even in outdoor, especially in areas where there is crowding, like public transportation terminals or even markets, and in areas where there is also higher risk of interaction, no, because of gatherings.
Okay, Doc, follow up on that. How do we make sure po na those sectors will follow, of course, yung masking pa rin given na, of course, we can control naman them kapag outdoors?
Yeah, we know by history it's difficult, no, in terms of implementation, but it's important for us, no, medical societies, even medias, to again reiterate the importance and inform the population at risk that their risk will still be there even in an outdoor if they will not be wearing a face mask. So constant communication at saka specific messaging will really be important when we implement this policy.
Sir, are you already projecting possible scenarios kung sakasakaling ma-implement na ito, maging policy na itong optional face mask?
Yes, there are possibilities. No, what I'm worried about is that when we will be implementing this, October, November, December, ang worry ko talaga is the waning vaccine effectiveness, especially for those individual who received the vaccine January, February, March, and after that wala na. No, waning effectiveness makes them vulnerable. Second, for those who have not been taking the booster vaccine 4 months from the time that they have received the primary vaccine series, those are for me signals that if there will be a lot of this population will be exposed when this will be implemented, then we should monitor number one again, no, the cases, the number of those who will be admitted in the hospital, and I will really say this: the vulnerable population is the one that we have to closely monitor, because until now, even the cases are going down, there are still vulnerable population that are admitted in the hospital. They're fully vaccinated, although mas maraming hindi bakunado, but still develop the COVID infection severe form.
Doc, worst case scenario, do you suggest na maglagay ng mga police or anyone who can remind the public or those specific part of the population na sinabi niyo na not recommended na sumunod dun sa optional wearing of face mask?
Mas magandang ganun, but depende pa rin yan sa local government unit, no? Because ang crucial dito is how the local government unit will implement and really operationalize this policy in real world.
Doc, sorry, one last. Sa IATF po yesterday, during the meeting, may pinresent na among the ASEAN members, the Philippines is among the only country na hindi pa, na mandatory pa rin yung face mask. Whereas, for example, itong Thailand, since June 24, voluntary na lang siya. And we have almost the same vaccination and booster coverage with Thailand. So how do we reconcile that?
Okay. Ang sagot ko dyan, no, it's quite really difficult to always benchmark with other countries, okay? Because magkaiba yung healthcare system natin, no? Magkaiba yung priority ng mga bansa. Yeah, I think ang point ko dito is that if we will benchmark with them, siguro yung mga, what are the important points that when they implemented that, ano yung mga experience nila, no? And we can improve on that. But for me, benchmarking dahil generalized na, oy, Singapore gumawa na dito, Vietnam gumawa na dito, eh tayo, sasama din tayo. No, we should consider what is our current rate of positivity, what is our current rate of people having the infection, the number of those vulnerable developing severe disease. I think these are important parts when we consider decision. Our antivirals. When you say Thailand, Singapore, their government has good healthcare support sa mga vulnerable. No, they have antivirals available. No, can we do that here in our country in terms of strengthening those support, the availability of those drugs that can prevent them from getting severe infection. So, a lot of factors should be considered. Hindi lang porke yung ibang bansa ginagawa na, gagawin natin.
Sir, last na lang, what do you think of that recommendation giving a number of months, maraming gathering, congregations ng mga tao? Your thoughts on that, please?
Yeah, I'm not worried about that. Kasi lahat tayo, the culture of the Filipino, pag malapit ng December, nagpupunta na tayo sa mga malls, nagpupunta na tayo sa mga crowded areas, nagpa-party na tayo. I'm not worried about that if our boosted population is already very high. What I'm worried is that when we will be doing that, and our waning effectiveness of vaccine will also be setting in during those months, then yun yung medyo mahirap na situation. And if there are still cases in the community with a highly immune-evasive variant like a BA.5, then it's really important for the government to monitor the cases during that time. Hindi tayo mag-panic, but we have to monitor and prepare the healthcare system.
Thank you, sir.